My name is Jonathan Allotey. I graduated from the College of Worcester in Ohio. I was a courier here in the year 2016, the summer of 2016. I served primarily in Jackson County at Kentucky One Healthcare, which is in Berea, but I resided with a host in Jackson County. I also served at Camp Andrew Jackson, which is in Jackson County as well. I currently live in Cleveland, Ohio, where I'm pursuing a graduate degree in physiology at Case Western Reserve in Cleveland. My experience here as a courier was really wonderful. I think coming in, after I got accepted into the courier position, I was not sure about how I'll be received. I am an African immigrant in the US, and I wasn't sure how much Eastern Kentucky was familiar with a black man from Ghana and all of that. However, I would say that Frontier Nursing University and the people of Eastern Kentucky warmly welcomed me. I was pleasantly surprised because you always fear the unknown. And when I got here, I realized there was nothing to fear. The college received me well. The staff of the college received me well. My host was very great. I thoroughly enjoyed my time here as a courier. My time spent with other couriers were wonderful. We visited a few wonderful places. We went to the Cumberland Falls, which has like a, what do you call that? Like a moon bow. We visited the first KFC. And we saw some beautiful scenery. Waking up every morning to the beautiful river in front of the garden house and looking at the mountains and the trees and having great breakfast are just some of my fondest memories in Eastern Kentucky. One of the things, among many things that I learned in the career program was I understood what an underserved area was and what that means. And so throughout my undergraduate education, every now and then you'd have a professor talk about an underserved area and all the things that need to be done for them or for these specific places. But living here, I think I really understood what it meant to be in an underserved area. In Jackson County, where I lived, we had one traffic light, which was central to everything that went around. The people, however nice, and they used all the resources to their advantage, but we had one clinic that served a population of maybe 5,000 people. And whenever someone needed an important surgery or had a major complication and needed to see some kind of specialist, they had to drive at least an hour to Berea, where they would be seen by trained professionals. And I think understanding some of that, there are not many grocery stores. There were a few, but compared to places like Cleveland, Ohio, Columbus, Ohio, or Charlotte, North Carolina, when you compare other parts of the U.S. to certain parts of Eastern Kentucky, it makes sense, and I think I understood what an underserved area meant. Secondly, working on site in Berea at Kentucky One Primary Healthcare, I shadowed Dr. Cranston, a physician, and I also shadowed an APRN, an advanced practice registered nurse, called Betsy Coblentz, and she was wonderful. Both physicians were wonderful. They guided me through the process of what it meant to care for patients, how to understand patients, and they also made me aware of the public health issues that patients were facing. Both practitioners primarily cared for patients who are suffering from diabetes, COPD, and hypertension, which are some common conditions in the area. And I got to see how intentional they were in encouraging lifestyle change among their patients. So they'll talk about daily simple exercise and some nutritional change and some other pieces of lifestyle that they were working actively with their patients to change. And that was great. I might be biased, but I would say that every pre-med, pre-nursing, pre-health, every student who considers going into healthcare and would want to know what holistic care really is should strongly consider applying and participating in the career internship program here organized by Frontier Nursing University. I would 100% recommend it. I think some of the things you would learn primarily would be cultural humility. And so one of the things is coming from a city, or maybe you're also coming from a rural place, but whatever your experience is, when you come into Eastern Kentucky, the people here love you so well, they care for you, you're able to give back as well, you're able to serve, and you leave with a sense of cultural humility. You start to understand when people say, like, don't read books by their covers, because you start to recognize that whilst there are some things that separate us from other cultures, we're just the same in many other respects. And I think one of the things I took away was a sense of cultural humility, so that whoever I'm serving, whether it's in Cleveland or whether it's in Columbus, Ohio, or whether it's in West Virginia, I go in knowing that I'm going to learn from these people. It's going to be a good experience, and I treat them as people as they treat me, just as a person. Another thing I would say is you do understand really what holistic care is through this internship process. As you serve alongside practitioners, that's advanced practice registered nurses or doctors, you do see how they care for individuals, how they care for families, but you also see how they're caring for the entire community. And so where I served, we had a support group for patients with diabetes, where patients with diabetes in the entire Jackson County were invited to these support groups and would have conversations about what it means for them to support each other in eating healthy and in doing simple exercise and in taking their medication. And so leaving here, not only was I aware of how medicine and how the practice of nursing was changing lives, but I also left understanding how a practicing physician or nurse could completely shift how an entire community approaches healthcare and lifestyle. The Courier program has a very rich legacy in Eastern Kentucky for years and years. Every year, starting with Mary Breckenridge and her friend, the children of her friends, coming down here to serve, to care for people, to walk alongside practitioners, and just to volunteer their time and energy and effort, has been valuable. There are times when you'd walk down the street here in Leslie County, and a lot of people would say, are you a courier? And so you can tell that there's a rich legacy here. You're not, once you wear that white shirt and those khaki pants and you walk down the street, people know, in the summertime, people know for the most part who you are and what you're doing, and the community, you can tell, appreciates it. So the legacy here is very rich, and it's really an honor to be part of it. Couriers have gone on to do a lot of great things around the country, but whilst they were here, couriers have come alongside a lot of practitioners to do good work, to make important phone calls, to handle some paperwork, to type up documents that the practitioners normally would not have time to do. And I participated in a lot of those, and it was nice to even volunteer time around the community to sometimes clean or do different things that I know was beneficial.